For part 6, we're going to talk about these third wave cognitive behavioral therapies. And the reason they're called third wave is because behavioral therapies or behavior therapies have gone through 3 distinct phases, this being the third. So the first phase were things based on animal models of classical and operant conditioning, things that pretty much excluded cognitive principles and just focused on the behavioral principles. So kind of just like behavior therapies that we just talked about. The second wave started in the 60s and moved into the 70s, and was when we started talking about cognitive behavioral approaches like rational emotive behavior therapy and cognitive therapy and modeling and role-playing. Again, stuff that we've kind of already talked about. So those were our cognitive behavioral therapies. But more recently, we've started to see the rise of what they're now calling third wave cognitive behavioral approaches. And so these therapies are starting to include things like mindfulness. We're starting to incorporate things from the humanistic and more Eastern methods. So instead of just focusing on Western ideologies, we're introducing this awareness or mindfulness that we got from humanistic approaches, and we're starting to be more aware of styles of treatment other than those we see in North America or Europe. So a little bit more inclusivity here. And so when we look at our mindfulness-based approaches, we're looking at approaches that are centering on this idea of mindfulness, which is a mental statement of awareness, focus, openness, and acceptance of our immediate experience. A lot of these approaches are going to be based around meditation. So focusing inwardly and becoming aware of what we're thinking and feeling, and especially how those thoughts and feelings might serve to trigger or cause different behaviors. So for example, if we think about, in an earlier chapter, we had talked about relapses coming from individuals who had addictions to, say, alcohol. You could use mindfulness and meditation to become aware of those thoughts and emotions that would trigger a relapse. And you could then adjust those thoughts and behaviors. And so by becoming aware of those problems, those things that were triggering a relapse, you could then help prevent one. And so instead of a relapse happening in a way that seems almost automatic, you can then interrupt it and disrupt the cycle. And so some of the mindfulness-based approaches we're going to talk about will be acceptance and commitment, and dialectic behavior therapy. So starting with acceptance and commitment therapy, or ACT, this type of therapy focuses on mindfulness specifically as a vehicle for change. Now, this might make you think a little bit of traditional cognitive therapy, where people were trying to control their thoughts and feelings and change them. But for this ACT, we're looking at more being aware of thoughts and feelings. So instead of actively trying to exert control, like in things we've talked about previously, our ACT is trying to just be aware of them, to understand them, to accept that they're happening, and potentially get some insight into thoughts and feelings that you may not have been aware of in the past. Now that sounds fairly simple, and if we use an example of, say we have someone who's afraid in social situations, they're afraid to interact with other people. If they are focusing on being mindful and aware of their thoughts and feelings, then maybe they might think something like, I'm worried that this person doesn't like me. I feel that this person doesn't like me. And that simple awareness and acknowledging that feeling can actually help reduce some of the anxiety associated with those feelings. So you've identified what it is that you're feeling, you've identified what it is you're thinking, and it can help diffuse some of the anxiety that would otherwise be affecting you. And even if you did start to feel anxious, you would then acknowledge and accept that anxiety as well. You could analyze that feeling as it comes up. And so this process helps you sort of accept what's happening and be aware of it. Now, because I had talked about this third wave cognitive behavioral therapy thing being quite new, we don't have a ton of research talking about how effective this is. But there have been a couple of studies looking at the effectiveness of ACT, and overall, there seems to be some agreement that there is moderate therapeutic effect, so it is having some positive effect. So if we actually hop to the next slide here, we have the comparison between a standard 12-step program, which is our blue dashed line here, and the red is going to be a mindfulness-based relapse prevention program, so MBRP. So this is basically looking to study people who have been treated for drug or alcohol abuse. And so they looked at 12 months before treatment, where they had a lot of days where they were experiencing alcohol or drug abuse, 2 months post-treatment. So after they had gone through these programs, we see that the 12-step program is still having more days where they abused the substance than those who went through the MBRB. Though by the time we get to 4 months post-treatment, they're both at about the same place. So a modest effect where it's having some positive influences, but it isn't necessarily better than other programs that are in existence. For our other topic we can talk about is the dialectic behavior therapy. And this is specifically a therapy that was designed to treat borderline personality disorder. And so again, if you remember, this disorder would have somebody who has chaotic interpersonal relationships, tend to be not in control of their emotions, they have self-destructive behaviors, and usually very low self-esteem. And so a lot of people who have this borderline personality disorder will end up making suicide attempts during their lives. And actually about 10% of them do end up ending their lives. So this is a dramatic disorder that has quite a strong influence on individuals. So there was a therapy designed specifically to try and counteract or treat that disorder. Now, because this disorder is very diverse, it covers a lot of different ranges, there are a lot of maladaptive behaviors being shown, but also because of the personality aspect of it, individuals with borderline personality disorder are pretty likely to stop trusting their therapist and drop out of therapy. So it becomes very, very difficult to treat them. And so to create this therapy, they had to combine elements from our cognitive, humanistic, behavioral, and psychodynamic therapies. So bring together all of the different kinds of therapies we've talked about so far to try and approach this particular disorder from multiple angles. So they would be using their behavioral techniques to try and teach the clients interpersonal skills, problem-solving skills, and emotional control. They'd use cognitive approaches to try and get them to have a more adaptive way of thinking about the world, their relationships, and about themselves. So get away from those maladaptive thought patterns and adopt something a little bit more healthy. You see some psychodynamic elements as we start getting into some of the history of treating borderline personality disorder, where they look at sort of childhood and the past that led to these individuals developing this particular view of the world. And then the humanistic approach comes in at the end, where we focus on acceptance of their thoughts and feelings to try and help them tolerate and exist through their unhappiness and the negative emotions that pop up. So we see a big combination of all of these ideas, all of these therapies to try and treat this disorder as a whole. And it's been fairly effective in doing so, and it's one of the only effective methods of treating this disorder, which is why it's worth mentioning here.